The 10 most dangerous sports. Discover which cause injuries and how to protect yourself. Did you know that some of the most popular sports in the world are among those that cause the most injuries? That's right. Whether in soccer, basketball, or even swimming, the risk of bruises, sprains, and even fractures is a reality that affects athletes of all levels. But after all, which sports cause the most injuries? And more importantly, how can you protect yourself while practicing them? In today's video, we will reveal the 10 sports that cause the most injuries in professional and amateur athletes based on scientific data and recent studies. In addition, we will give you tips on how to minimize these risks and continue practicing your favorite sport safely. So leave a like, subscribe to the channel, and join us in this list that might surprise you. Before we begin, it is important to remember that injuries are part of sports, but many can be avoided with the correct technique, proper physical preparation, and protective equipment. Let's understand why some sports have such high injury rates and how we can reduce these numbers. To create this list, we considered various global statistics on sports injuries, data from scientific research such as studies published in the International Journal of Sports Medicine and the Journal of Strength and Conditioning Research, as well as information collected by hospitals and sports federations, were analyzed. The main criteria we used were frequency of injuries, how many injuries occur per 1,000 hours of training or competition. Severity of injuries, the most common types of injuries, from mild sprains to severe fractures requiring surgery. Contact sports versus individual sports, how the level of physical contact impacts the risk of injury. Popularity of the sport, the more people practice a sport, the more injury cases are recorded. It is important to highlight that the risk of injuries may vary depending on the country, competition level, and even the age of the athlete. Therefore, our list is based on general statistics and may have variations depending on the context. Now that you know how we selected the most injury-prone sports, it is time to find out which sports rank in the top 10 of the most dangerous for the human body. Let's go. 10th place, soccer. Soccer is the most popular sport in the world and consequently one of the leading causes of sports injuries. With a high level of physical contact, sudden changes in direction, and intense plays, players are constantly at risk of sprains, bruises, and ligament ruptures. The most common injuries in soccer include ankle and knee sprains, anterior cruciate ligament, ACL, tears, and muscle strains. Studies indicate that for every 1,000 hours of play, about 7.8 injuries occur. The speed of the game and the contact with other players further increase the risk, especially in ball disputes and aggressive tackles. To minimize injuries, it is essential to warm up properly, strengthen muscles, wear appropriate cleats, and respect the body's limits. Additionally, maintaining good technique helps avoid dangerous movements that can lead to serious injuries. Even though it is a passionate sport, soccer requires care and adequate physical preparation to prevent serious problems. 9th place, rugby and American football. Rugby and American football are known for being extremely physical and high-contact sports. Unlike traditional soccer, these sports allow players to block, tackle, and collide with each other, significantly increasing the risk of traumatic injuries. Hip, knee, shoulder, and spine injuries are common, especially dislocations and bone fractures. The constant impact can also cause concussions, one of the most serious and frequent injuries in these sports. According to NFL data, an American football player can experience impacts equivalent to a high-speed car crash during a game. In rugby, the lack of protective equipment such as helmets and rigid shoulder pads makes athletes even more vulnerable to severe injuries. Strategies to minimize risks include proper use of equipment, training in safe impact techniques, and muscle strengthening to better absorb shocks. Even so, these sports remain among the riskiest in the world. 8th place, combat sports, MMA, boxing, judo, jiu-jitsu. Martial arts and combat sports are, by nature, high-risk activities. After all, the goal is to strike the opponent and, in some cases, knock them out or force submission with joint locks. The most common injuries in combat sports include bone fractures, contusions, joint dislocations, and ligament injuries. In MMA and boxing, repeated blows to the head can cause brain trauma, which, over time, may lead to serious neurological problems such as chronic traumatic encephalopathy, CTE. In judo and jiu-jitsu, the biggest concerns are shoulder and hip dislocations, as well as knee sprains due to frequent falls. Poorly executed immobilization techniques can cause ligament damage in the elbows and knees, often requiring corrective surgery. To reduce the risk of injury, it is essential to learn and practice techniques correctly, strengthen the joints, and use protective equipment. Even with all precautions, combat sports demand high physical endurance and expose athletes to violent impacts. 7th place, weightlifting and powerlifting. Weightlifting requires extreme strength and precise technique. If performed incorrectly, it can lead to severe injuries in the spine, hips, knees, and shoulders. One of the most common issues in this sport is a labral tear, which occurs in the cartilage connecting the femur to the hip, causing intense pain and sometimes requiring surgery. Another frequent injury is a lumbar disc herniation caused by excessive weight and improper technique. Powerlifting athletes are particularly prone to muscle tears and ligament injuries in the knees and shoulders due to the use of extremely heavy loads. Poor execution of movements can lead to joint dislocations and even stress fractures. The key to preventing injuries in this sport is training under supervision, using support equipment such as knee wraps and lifting belts, strengthening stabilizing muscles, and respecting the body's limits. Weightlifting can be highly beneficial for physical conditioning, but must be practiced with extreme caution. 6th place, CrossFit. CrossFit has become extremely popular in recent years due to its combination of weightlifting, gymnastics, and high-intensity functional exercises. However, the high physical demands and fast movements put practitioners at a high risk of injuries. The most common CrossFit injuries occur in the lower back, shoulders, and knees. Excessive repetition of movements without adequate rest can lead to issues such as tendinitis, muscle strains, and even stress fractures. One of the main contributors to CrossFit injuries is improper execution of exercises. Many beginners try to keep up with advanced workouts without proper progression, putting excessive strain on their bodies. To minimize risks, it is essential to follow a progressive training approach, allow time for muscle recovery, and focus on proper technique before increasing weights. When done with guidance and care, CrossFit can be extremely beneficial, but without control, it can become one of the most injury-prone sports. In the next few minutes, we will reveal the sports that make up the top 5 of our ranking. What will be number 1? Stay with us to find out and learn how to prevent injuries in these sports. 5th place, tennis. At first glance, tennis may seem like a harmless sport, but don't be fooled. It carries significant injury risks. This sport requires explosive movements, sudden accelerations and decelerations, and repetitive impacts on the joints. The most common tennis injuries include ankle sprains, shoulder tendinitis, and the well-known tennis elbow, lateral epicondylitis, an inflammation of the forearm tendons caused by repetitive strain from serving and hitting the ball. Studies show that tennis players have a high incidence of overuse injuries, especially in the upper limbs. Additionally, rapid lateral movements can overload the knees and hips, increasing the risk of ligament injuries. The improper use of footwear, hard playing surfaces, and intense training without adequate recovery also contribute to these problems. To prevent injuries in tennis, it is essential to perform proper stretching before and after training, engage in specific muscle strengthening, and use correct techniques when hitting the ball. Moreover, taking breaks between matches is crucial to avoid overuse injuries. Tennis is an incredible sport, but practicing it without proper care can lead to serious injuries. Fourth place, basketball. Basketball is a high-intensity sport that combines frequent jumping, rapid direction changes, and physical contact. These factors significantly increase the risk of injuries, especially among amateur players who do not have the same physical conditioning as professionals. Ankle sprains are the most common basketball injuries, accounting for about 25% of all injuries in the sport. They occur due to the repetitive impact of jumps and the possibility of stepping on another player's foot upon landing. Knee injuries are also frequent, including anterior cruciate ligament, ACL, tears, one of the most feared injuries among athletes. The lower back and shoulders also suffer due to the repetitive shooting motions, which can lead to tendinitis and muscle inflammation. To minimize risks, players should strengthen their lower body muscles, wear shoes with good ankle support, and practice balance exercises to prevent sprains. Basketball is a dynamic and exciting sport, but proper physical preparation is essential to avoid serious injuries. Third place, road running. Road running may seem like one of the safest sports, but statistics show that it ranks among the activities with the highest incidence of overuse injuries. This happens because many runners increase intensity or mileage too quickly without allowing their bodies proper recovery time. The most common running injuries include plantar fasciitis, iliotibial band syndrome, and stress fractures. Plantar fasciitis is an inflammation of the sole of the foot caused by repetitive impact on asphalt. Stress fractures occur due to constant overloading of leg bones, being more common among runners who cover long distances without adequate rest. Another common issue is patellofemoral pain syndrome, also known as runner's knee, caused by the repetitive friction between the kneecap and femur. This wear and tear can be prevented by proper muscle strengthening, wearing appropriate shoes, and adjusting running technique. To run safely, it is essential to respect recovery periods, vary training types, and strengthen stabilizing muscles. Running is an excellent exercise for overall fitness, but caution is necessary to avoid overuse injuries. Second place, squash. Squash may not be as popular worldwide, but it is one of the most practiced sports and has one of the highest injury rates per hour played. The fast pace, sudden directional changes, and high endurance demands make injuries common among athletes. The most frequent squash injuries involve the ankles, knees, and hips due to rapid movements in a confined space. Additionally, there is a high incidence of shoulder and elbow injuries caused by the repetitive swinging motions. Another significant risk in squash is cardiovascular strain. The game demands intense bursts of effort, which can put excessive strain on the heart, especially in amateur players who are not physically prepared for the sport's intensity. To prevent injuries in squash, it is essential to perform a proper warm-up, strengthen joints, and wear shoes with good cushioning. Although it is a fast-paced and enjoyable sport, lack of preparation can make it extremely dangerous for the body. First place, swimming. Now we arrive at the most surprising sport on this list, swimming. Many people believe this is one of the safest sports, but in reality, it ranks highest for injuries when considering high-performance athletes. Swimming involves repetitive, high-range movements, which can lead to supraspinatus tendinopathy, an inflammation of the shoulder tendon that is extremely common among swimmers. This issue worsens with high training volumes and a lack of proper muscle strengthening outside the pool. In addition to shoulder injuries, swimmers frequently develop lower back and neck pain caused by joint overload and repetitive movements. Swimmer's shoulder syndrome is a condition that can sideline athletes for months, requiring intensive physiotherapy and, in some cases, surgery. The good news is that these injuries can be prevented with strength training, stretching, and proper workout planning. Swimming remains one of the most beneficial sports for overall health, but proper technique and workload control are essential to avoid musculoskeletal problems. How to prevent sports injuries. Now that you know the 10 most injury-prone sports, it's important to remember that no sport is entirely safe, but all can be practiced with reduced risks if the necessary precautions are taken. Muscle strengthening. No matter what sport you practice, strong muscles are essential for preventing injuries and improving performance. Correct technique. Learning to perform movements properly reduces overload and minimizes injury risk. Appropriate equipment. Wearing proper footwear, clothing, and protective gear can make a huge difference in sports safety. Rest and recovery. Training without adequate rest increases the risk of overuse injuries. Always respect your body's recovery time. Now we want to hear from you. Which of these sports do you practice? Have you ever suffered an injury? Tell us in the comments. If you enjoyed this content, like the video, subscribe to the channel, and share it with your sports-loving friends.